The Minister of Health has just opened phase 1 of the field hospital in Port Elizabeth. Currently, the phase 1 will provide 1,485 beds, but when completed, will provide 3,300 beds. The field hospital comes at a time the Minister of Health has urged communities to play their role to make sure that they actually contain this virus as we are going to the peak season, and the numbers are expected to go up. Currently, in the Eastern Cape, we have surpassed the 16,000 mark, and also in Nelson Mandela Bay, where the hospital is situated, we are currently bubbling around 5,000 of those numbers. But joining me now, just to talk more about this hospital, is the Premier of the Eastern Cape, Oscar Mabuyane. Premier, thank you so much for your time. Government has been calling for this partnership between the private sector and the public sector, and finally it's happening in the Eastern Cape during a critical time when we are trying to contain this virus.
This is legendary, and it's one of those quite inspiring moments when you see the dream come true. Just a few months ago, less than 3 months ago, when we met, spoke about this idea, it was something that you can't really easily fathom, but it has now that came to the fruition. We are really appreciative to the commitment Volkswagen has actually demonstrated here, the cooperation between ourselves as provincial government, the Nelson Mandela Bay municipality, as well as the Volkswagen, with the German government, agreeing to invest more than 100 million for people of this province, particularly in this area of Nelson Mandela. You would understand that Volkswagen has been around here for 74 years. And this is exactly what we are talking about when we say the private sector, the capitals of the industry must be able to invest where they are actually generating profit from. So it's quite impressive, but what is more impressive as well is the value chain. If you listen to the report on the beneficiation, local economic development impact, these beds that you see here, thousands of them have been manufactured here by our people. A lot of SMMEs have been developed during this process. We are still launching phase 1. We are going to phase 2, phase 3. More opportunities are coming. People must just be business. They must just focus on business and be given opportunities and be developed, be skilled. So it's a really an eye-opener even as well in government. We have learned a lot on the issues of project management, issues of taking responsibility serious, turnaround time, delivery, when you are given a task. I think bureaucrats that were here, they've seen it. It is possible. Volkswagen has been here for years. We can learn a lot. I believe that as provincial government, had we partnered with them on a number of things long time, we should have been far from where we are now. As you have said, numbers are surging up. We are very much concerned, and we knew that the inevitable is unavoidable. People are going to die because of comorbidities, challenges that we have in the province, the compromised immune system, health profile of our people. We are trying our level best by doing all what we are doing to minimize and mitigate such negative impact. And I'm quite happy on behalf of people of Eastern Cape. We are welcoming this, and I hope many businesses around who have been around will see something better and good on what Volkswagen has done. Our people are terrified. Our people are really under pressure. Our people have anxiety. Our people fear this. So we've got to work together. We've got to partner to ensure that we save lives. We have said as we continue saving lives, but at the same time, we must balance that with the preservation of livelihood. So all these go together. But the point that Minister has made, people must take responsibility, as President also instructed. This virus can only be defeated when people take responsibility about their lives. When people understand that the virus moves with the motion of human beings. If people are at home and not moving, the virus has got no room. The virus cannot spread. We are appealing to our people that let's observe the protocol. Let's stay at home. Let's wash our hands regularly. Let's wear our mask as we go out for whatever reasons. But let's keep social distancing as well. So it's going to be important maintaining that social distancing. If we do so, we will be able to defeat the virus. We are concerned. Numbers are really surging. We are trying to contain numbers. Our containment strategy talks about that. We are doing our level best on screening. We have screened more than 2.5 million in Eastern Cape. We have tested more than 130,000 as we speak. Out of that, we've got about 17,000, just 16,800 people. But what is also more inspiring is the hard work which has also been demonstrated by our frontline healthcare workers. We've got more than 8,000 people who have recovered, which is more than 50% of the actual infection rate. So we are quite impressed with that kind of work. We are really appreciative with that commitment, selflessness, dedication that is shown. So we are looking forward to more commitment moving forward. And we have just realized in the last few days that our daily rate has gone above 1,000 for the first time. So it tells you that we are gravitating towards the peak that we've been talking about. And we must really appeal to the social behavioral change from our people, so that our people dislodge this virus, so that we fundamentally disrupt the transmission of this virus from one person to another person.
I know a lot of people in the Eastern Cape are living below poverty lines, which make it so difficult for them to self-isolate. Sometimes you'll find in a household, it's 5 people living in a 2-room house. How is this hospital going to work? Is it only those people with under medical conditions, or everyone that has tested positive will be quarantined here?
Everyone who has tested positive who must be isolated. Of course, the people do have constitutional rights to be self-isolated at home, but many of our people don't have that luxury, even if they would want to. That's why we've got a field hospital in the stadium, which has accommodated some people. So this is meant for the poorest of the poor who cannot be accommodated in the private hospitals, but this is an opportunity for them. We are calling our people to volunteer where you are. Don't hide yourself. We know the stigma issues in the community. Don't hide yourself anymore, because if you do that, you are a risk. You are killing other people unintentionally. Come forward, come and admit yourself here. You are safe here. You've got food, you have got security, you have got everything. You will be well looked after. You will recover within 14 days. So we are calling all those people to come forward. What we have also observed in the Eastern Cape, as numbers of deaths are growing up every day, is that many people who are also dying are those who are said to be asymptomatic. You hear a person to say, I've received my results today, but I don't feel anything. 2 days down the line, that person is dead, and that person couldn't even go to hospitals. And because of those medical underlying conditions, because of those comorbidities, we are saying now, whoever that we know as health, I know the issue of privacy, patient-doctor privacy arrangement, but all those people who have underlying medical condition, we can no longer afford to have them self-isolating at home. They must come here so that at any given time they are looking for oxygen, they can get oxygen. At any given time they are looking for ventilation, they get ventilation. So all that must actually be, it is actually built on how now we work to intensify, to ramp up our work on contact tracing, and further looking at testing significant contacts. So we want to really do more on that space, get all those people outside the community, because as long as people are still out there, people are not observing. Others are doing it deliberately, others are doing it unintentionally. We are appealing to our people. Please don't be a source of devastation in your family. Don't be a source of curse in your family. You know that you have tested and tested positive. Come forward. You can still be assisted. This platform is created for that. It is meant for everyone. It is meant for people who need help.
Okay, thank you so much, Kunmi. I know we have a lot to talk about, but because of time, we have to get back to the studio. On my side, and my colleague Natasha Makundulu, back to you in studio.
All right, thanks.